So that's where we start getting the symptomatic kind of expression of the disease. So I kind of mentioned blepharitis and dry eye. Blepharitis is where we start getting inflammation along our eyelid margin. So there's bacteria, there's staph, seborrheic, and even these little mites called Demodex that can start building up on our eyelids, creating almost a sticky biofilm. And, just like any other living organism, those bacterial microbes, they're feeding off of the oils and the scaly dandruff that's sitting on our lids and lashes, but they're also excreting some byproducts. Those are toxins. I don't like to say it, but it's basically bacterial poop. They're releasing all that stuff that's getting into your actual tear film. So if you're a contact lens wearer, if you're on a computer screen all day, if you're a child that plays sports, all that stuff is getting into the actual ocular surface, making your vision blurred, making your eyes uncomfortable. It can actually lead to, like I said, the expression of disease and issues that need to be treated medically.